welcome to our third webinar. I'm Cecilia Clarke. I'm President and CEO of Brooklyn Community Foundation. And I'm so delighted to have you join us. I know that this is a very stressful time. So the fact that you've taken out some time to join us for this webinar is just really important to us, and I hope also to you, and that it will be informative for you. I'm just going to give a little bit of a background on our Brooklyn COVID Response Fund, and then I'm going to hand it over to the experts on this webinar. So to begin, Brooklyn Community Foundation actually launched their fund over 5 weeks ago. We were actually one of the very first funders in the country to launch a fund. We knew as Brooklyn's Community Foundation that Brooklyn was going to be hit very, very hard by this crisis. And in fact, as we know, that has turned out to be true, unfortunately. And I think one of the important things for us as we got started was that while this was a unique crisis, it was still a crisis that we needed to respond to in the way that we did business ourselves. And that is rooting our response and rooting our values around racial justice and racial equity. And so to that end, we very much and actively use that lens as we do our work around COVID. And I also would love to say that as of Monday, we will have gotten over $1 million out to community-based organizations in Brooklyn who are working tirelessly and sometimes heartbreakingly in the face of this crisis. These are really truly people who are working on the front lines. You're going to hear from that person, one of those people, in about 5 minutes, really working towards on the front lines of this crisis. This is our third webinar. The first one, as some of you may have known, was just kind of an overview. 2 weeks ago, we focused on undocumented immigrants and the impact on undocumented immigrants. I encourage you to go back to our website at some point and listen to that. It focused on undocumented immigrants in the Sunset neighborhood of Brooklyn. And this week we are going to focus on really one of the most salient crises within this crisis, which is, of course, how shelter in, while supposedly to keep us all safe, and yes, effectively keeping us safe, is in fact really unsafe for many women who are trying to get through this crisis. And that's the spike in domestic violence that we're seeing with COVID. So we're really honored and grateful to be able to support these efforts. We have supported several organizations that are working around gender-based violence and family violence. Again, I'd encourage you to go to our website. All of our grants to date are divided by issue area, and I would encourage you to take a look at that. In other news, we have actually gone past 2.5 million in funds for this fund. I can't begin to tell you how grateful I am for this. This is truly Brooklyn turning out for Brooklyn, and even actually a lot of other people turning out for Brooklyn, it turns out. And we are just really honored and grateful for that support. The reality is we need to double that support. The program team, as Amy will talk about, they're getting over 50 applications weekly. We are in fact getting money out weekly, but there's only an increasing number of requests for really very serious, hardworking frontline emergency workers and community-based organizations. So one thing I would certainly say to all of you, and I'll probably repeat this at the end of the call, is we are grateful for any support you can give to this COVID Response Fund, or please tell anybody you know to please support the fund, because it's supporting these incredibly critical efforts to try to mitigate this crisis in any way that we can. So I'm going to turn it over. First of all, I'd like to just do a shout out and a thank you to my colleagues, Jamila Syed and Jenny Walski, who don't get the glamour of talking on a webinar, but in fact are really running this thing from behind the scenes so beautifully. So many thanks to Jamila and Jenny. And of course, I want to welcome our program officer, Amy Chou Sheikh, who will talk a little bit about our grant making. And of course, we'll be interviewing Kavita. So Kavita Mehra is the Executive Director of Sakhi for South Asian Women, one of our earliest grantees. We're honored to support this incredible organization. And I think she's really going to shed a very meaningful light on this issue. So with that, again, thank you all so much for joining us. And I turn it over to Amy.
Great. Thank you so much, Cecilia. And I also wanted to share love and props to the team, Jenny and Jamila. Hello, everyone. Thank you so much for joining us today. I am Amy Chou Sheikh, and I'm a program officer here at the foundation. We're so glad that you're able to take time out of your day to join us today. And before we jump into our conversation, I'm just going to give a quick overview of the fund. So in early March, before launching the fund, we engaged in multiple conversations with our grantee partners, our community partners, to hear more about their urgent needs and what they're seeing on the ground. And we essentially designed our fund based on what we were hearing and learning, and we continue to evolve as we learn more. As Cecilia mentioned, the fund was really created to address the disproportionate health, social, and economic impacts of the pandemic, particularly on communities of color. So that means that we're deeply rooted in our values of racial equity and justice, which shapes all of our work. And that includes grant making, capacity building, support, and advocacy. So this all means that we prioritize funding grassroots and frontline organizations who are often overlooked by traditional philanthropy. And we are committed to investing in these organizations. So currently the fund is providing grant making support to efforts to combat anti-Asian racism and xenophobia, prevention and practical needs for vulnerable populations such as older adults and immunocompromised individuals, food access, support for low-wage workers, and other emerging needs such as domestic violence. Organizations can apply for grants for up to $10,000 general operating support through a very simple application process. And we're able to get these grants out the door really quickly within a week, which other foundations might not have the capacity to do so. And we understand that these are really urgent times, and we're able to respond quickly and decisively. And in future phases, we'll be providing grants for longer term responses. So just one logistical note before we start. So throughout our conversation today, if you have any questions, you can find at the bottom of the screen a Q&A tab, and we'll be answering your questions towards the end of the webinar. And with that, let's jump into our conversation today. So we have reviewed close to 250 applications so far, and we noticed a reoccurring theme that kept on coming up, and it was around the challenges faced by survivors of domestic violence in the midst of mandatory shelter-in-place regulations, which places them in harm's way. So this crisis hits home for all of us. While we associate home with comfort and safety, many survivors see their home as a place of terror. So through our fund, we've been able to resource organizations such as Day One, who are providing young people who've experienced intimate partner violence with emergency assistance, counseling, legal advocacy, and educational tools. Safe Horizon, who are working with immigrant survivors to preserve in-person essential lifelines, including hotlines, shelter, and child advocacy services. And we're also funding the New York City Anti-Violence Project, which supports LGBTQ and HIV-affected survivors of violence. So these are just a snippet of the few organizations in our fund, and I encourage you to check out the full list of our grantees on our website at brooklyncommunityfoundation.org under the COVID-19 tab, which is updated weekly. And of course, we are also proudly supporting Sakhi for South Asian Women, today's guest speaker. Sakhi is a survivor-led organization that works with survivors through a combination of efforts, including, but not limited to, direct services, advocacy and organizing, technical assistance, and community outreach. We are so thrilled and grateful to have Executive Director of Sakhi, Kavita Mehra, join us today for this critical conversation on the impact of COVID-19 on survivors of domestic violence. Kavita, thank you so much for being with us today.
Thank you for having me.
So Kavita, domestic violence impacts many individuals in Brooklyn, and current conditions have really exacerbated the risks to survivors and their children. So how have stay-at-home regulations been impacting the survivors that you work with, and what do survivors do if they're confined at home with an abusive partner?
Yeah, that's a great question. And thank you again for giving us the opportunity to really uplift the work that we're doing and also the challenges that survivors across New York City are facing vis-a-vis the pandemic. And so for some context, the community that we serve, the South Asian diaspora, is resting and living in the epicenter of the epicenter, which includes significant parts of Brooklyn, including the Kensington area. What we've seen overall is a significant drop in our helpline calls. So when we compared our numbers from March against February, we saw a 53% drop of helpline calls. And when we compared March against January, we saw a 68% drop in helpline calls. So what that means to us is that survivors are not safe, that they don't have a safe place to make a call or seek support at this time. And then specifically speaking about survivors who are living with their perpetrator right now, we're seeing trends of abuse, and it has been shifting week by week. So in the earlier part of when we started shelter in place, we saw more survivors and perpetrators really neglecting and disregarding orders of protection. We saw more and more men answering cell phones. We had a case which was referenced in the New York Times of a survivor whose husband, or perpetrator, excuse me, cut off her cell phone because of the economic hardship that the family was facing. So he literally cut off her lifeline to the rest of the world. And then more increasingly, we're seeing trends around forms of sexual violence. And now, so survivors are now asking for contraception. They're asking for how to stay safe. Overall, what survivors are having to make the choice with is staying with their perpetrator, which is inflicting forms of abuse on them and or their children as well, or being at risk of leaving their home and then potentially becoming infected with COVID-19. And they're willing, and they are unfortunately making the decision to stay in place and continue to experience abuse during this time.
And so, go ahead, Kavita.
No, I was going to say, so to the second part of your question, which was, how does one stay safe, or what does one do if they are living with a perpetrator? The number one thing is to really enforce safety and planning. And so as soon as we went virtual, we made aggressive outreach to all of the survivors that we work with and reinforced safety planning. That was the number one thing. And that includes having access to one's local police precinct, having the address of one's local shelter, having friends and family in place, having documentation, legal documentation in place. That's absolutely critical. Creating code words with a friend or a family member if one is in harm. So code words that we use at Sakhi are, I really feel like having ice cream right now, or I'm craving biryani, which indicates to the advocates that we work with that a survivor is not safe right now.
And Kavita, you and I have talked about, I think the general narrative in media is that there's been increased rises in folks sort of sharing that there are survivors of domestic violence, and that you, in your experience working at Sakhi and with your team, that it's a really different narrative, and that sort of reaching out through your hotlines have actually decreased. So what does that mean for your clients and for the work that you do?
What that indicates to us is, again, that just building on what I said before, is that survivors are not safe. And this is actually trends that we're seeing in New York City overall. And so it matches with what's happening in New York because we live in smaller spaces. That Times article that came out about the spike in domestic violence helpline and hotline calls was more of a national indicator. And honestly, it's because people live in bigger homes. And that's one clear indication of that. But we are also living in a time, and I'm sure we'll talk about this in a little bit, but survivors, especially immigrant survivors of gender-based violence, are living with an incredible amount of fear. And not only are they living with that fear, living with their perpetrator, but also the administration has just completely upended with the new executive order what survivors are feeling. So we're actually, in the last 2 days, we've been receiving a lot of information from survivors about that as well. And
go ahead.
Oh, I was just going to say, and feedback from them about, the fear that they're experiencing as a result of the recent executive order.
And so due to like the crisis of COVID-19, like there's having to address that on top of working with survivors who are already in crisis mode, right? And
Yeah.
so because of this new challenging environment and this essentially new reality, what are some changes and adaptations that Sakhi has had to make to support survivors that you work with?
Yeah, that's such a great question. And so it really helped us conceptualize what does it mean to be an essential worker right now. So we went remote as of March 12th. And we were able to pivot very quickly. So all of our programming, for the most part, has continued seamlessly. Our therapy is still happening. In fact, we've seen increased demands for counseling sessions, and that's an indication to one that mental health counseling is really valued by our community, and it's becoming further destigmatized. And then, in addition to that, we've had our advocacy work continue without a hitch. All of our legal clinics, our economic empowerment team has been significantly burdened with the economic impact of what's happening to survivors. So being able to access public benefits has been a huge need. We've shifted, and really it's because of funders like the Brooklyn Community Foundation that's allowed us to shift very quickly some of our work. So we run a food justice program, and that has been a small program that we've had for over the last year or so. That is essentially a food pantry. When you walk into our offices, you'll see non-perishable items. What we were hearing very early on, and what we consistently continue to hear, is the continued food insecurity that survivors are experiencing, and especially for single moms who can't leave their house. And 80% of the survivors that we work with are mothers. They don't want to risk exposure for their children, and or they're facing such economic hardship that they cannot afford food right now. So we have hired a team. We've hired a chef who is sourcing food from a distributor, and we've hired a driver who is driving and dropping off groceries. So we're feeding anywhere from 35 to 50 survivors and their families a week. Which is completely new for us. And for us, this was a real test of, this is exactly why Sakhi is here as an organization, to serve the community in this capacity. And in whatever way we can, we're going to do that.
And so something else that, you kind of alluded to while talking about the work is this experience of survivorship and sort of the intersections of like the economic implications. And many of these survivors are low-wage workers. And so what are you seeing in terms of what, their economic situations changing?
Yeah, I mean, so we are, so of the survivors that we work with, those who are working, 90% of them are hourly waged workers, which essentially means that they have lost some form of income. We are seeing food insecurity, housing insecurity, overall economic insecurity. And so as a result of that, we're seeing increased demands for basic livelihood things. So food, rent support, emergency assistance around being able to get diapers and formula for their children. And so across the board, survivors just don't have access to anything right now. And so we're seeing a real need. I should probably also lift up that, what we're also seeing is survivors who are becoming more, are showing symptoms of testing positive with COVID-19. And so most of the survivors we work with don't have access to healthcare. So for them, we're also doing just planning. What does it mean so most recently we had to provide emergency cash assistance to a survivor. So she is tested positive with COVID-19, and she has to figure out how her 2 children will be taken care of if she has to go to the hospital. And so we had to provide emergency cash assistance to that survivor so she could pay for a babysitter for several days for her children. So those really difficult, hard choices where now we're seeing, because the community we work with is exposed so significantly and radically from the pandemic and from COVID-19, we have to be able to support them in this way. So it's the economic hardship as a result of what's happened, but also now survivors just getting sick and how to support them through this.
And sort of, thinking about the family unit, like what has been the impact of COVID-19 on survivors and also the children in the household experiencing and witnessing this abuse?
We know that it's causing a significant amount of anxiety and depression. We know that children are exposed. We know that for survivors, we have one case in particular of a survivor who's experiencing extreme sexual violence on a regular basis. We're trying to figure out a way to get her contraception, actually, and that's become a more recent trend. But she doesn't want to leave because she has 2 small children. And even if we paid for an Uber for her to go to a family member's house in New Jersey where she would be safe, she doesn't feel comfortable taking that risk with her 2 small children. So those are the types of choices, unfortunately, that survivors have to make in the midst of this moment. And so we know that children are further exposed to forms of abuse as a result of this, when in other circumstances, they would potentially be in a much safer environment.
And it really makes me think of just the tremendous amount of trauma, I think, that these survivors are experiencing in their day-to-day experiences, but also the added trauma of the COVID-19 on their experiences so far. And so how does your team address, the trauma, and how have you shifted the way that you do work because of it?
Yeah, I mean, this to be handcuffed to one's home in the midst of this is absolutely trauma-inducing, right? And so the work that our team, which I have an immense amount of respect for, they're just remarkable, to be able to absorb what survivors are experiencing, the anxiety that they're experiencing at this time, has continued. And as I mentioned earlier, the demands for mental health support has increased. And so our counselor has seen an average of like 6 to 8 additional conversations with unique clients in a given week. And so we're seeing a significant demand around that. We're also seeing perpetrators using forms of using the pandemic as a form of abuse. So something that was also in the New York Times last week was a case of one of our clients, Salma. Her perpetrator won't let her see her son because she doesn't have private transportation, and he won't allow her to see her using an Uber. And so because he feels like that's going to expose their son to COVID-19. And so, our team then worked pretty aggressively to be able to address that. One, we lifted up the conversation, we brought it to the media. So we've been able to really think about how to support survivors in more nuanced or more unique ways. And then 2, thinking about how do we get private transportation for this particular survivor so she can see her son. And so we've just had to be really agile. And also the team has had to think really creatively about how to support survivors during this time.
Yeah, and it sounds like your team have been really flexible, creative, and agile in sort of shifting and pivoting the way you offer services. And so what challenges still remain at this time, and how does that impact your work, moving forward?
Yeah, so Ramzan's here, it's around the corner. And so we've been thinking a lot about, how to support community during this time. Our food justice program and the deliveries that we're doing, we've made it trauma-informed as well as culturally specific. So thinking about, how do we add in dates? Because that's such an important part to breaking one's fast during Ramzan, and so we're thinking about, some of the other challenges, which include, we're feeding on average, 35 to 50 survivors a week. We know the demand is much more. We know that is going to increase. We know that it should be closer to 70 to 100. So that's one of the challenges that we're facing. As I mentioned earlier, trying to get contraception to survivors right now, that's been a challenge. Emergency cash assistance is something that we're doing, and it continues to be something that we've always done it, and we've just increased. We've sort of doubled down on our efforts to be able to support survivors in this way. So I would say that's become another challenge, but more on a systems change or structural level. Like, I think the executive order that's coming out around banning immigration right now. So we do have a case where a survivor was trying to petition for her son who lives in South Asia. Is now feeling the anxiety of now no longer being able to petition for her son, or the 60-day period in which she can't bring her son here, or whatever it is. But survivors are now in the last 2 days have been coming to us and saying, you know, what does this mean? How will this impact my family, my community, and you know, my own sense of healing through this time. So we're keeping our finger on the pulse as it relates to that. And so that has become a new challenge that's shifted. It's not COVID specific, but it's a moment in which it's another layer of trauma that's come to the community.
And so thinking about just the scope of services and the shifting of services and just the complexity of just survivorship and how that intersects with food justice and economic justice, you know, how has the grant from the Brooklyn Community Foundation supported you all, and how will it support you all in your work?
Yeah, I think so. What Cecilia said was so spot on. So the end of March is when we received our grant. And I would say that the early and the middle part of March was such a dark period for us, especially the week right when we went remote. We just had no sense of what was going to happen. And quite frankly, we have an annual gala that happens every year. We made the decision on March 17th to no longer have the event, which scared us. And it's such an important part of our general operating support. So we knew we were going to be missing out on some funding. We also knew there were increased demands from the community where survivors were calling us and saying, I don't have access to food. And as an organization, we had to make a decision to say, you know, how are we serving this community in the midst of, you know, taking a significant amount of risk? What the Brooklyn Community Foundation's grant did for us was give us the confidence and the ability to be able to say, we can serve the community. Being out in front of the funding community and being one of the first funders out there, and really the first grant we had received, demonstrated to us that it was going to set the tone for the rest of the funding community as well. And so that was deeply appreciated, especially as we continue to serve survivors across Brooklyn and Queens and the Bronx, especially.
Yeah, that's so great to hear. And we're so grateful to be in partnership with you in this work. And I just, for closing, just wanted to thank you so much for your wisdom, your insight, and your knowledge. And so I wanted to make sure that we get to questions that folks on the webinar posed is your service area Brooklyn, or do you work in other boroughs as well? How many clients do you serve in a typical year?
Those are great questions. So we serve clients across New York City. We do have a significant part of our client base in Brooklyn, especially the Kensington area. We're projected, we're supposed to be opening we'll be opening a third office in Brooklyn in 2021. And in terms of how many clients we see, we're seeing about like 425 to 450 clients a year.
Wow. And so I don't see any questions come in.
Questions.
Oh, go ahead.
I have some questions. Kavita, first of all, thank you so much. I feel like you gave a very kind of a really concrete understanding of just how multifaceted the crisis is. So I actually have two questions. One is, I'm sure you've been asked this before, so it's interesting that you've seen a reduction in hotline calls, which of course is a red flag to a lack of safety. I completely understand that, and it's really, really kind of horrifying, I think. But therefore, how do you know how to serve your survivors, and what are kind of the ways that you work around that?
Yeah, that's such a great question. So we have been we've been doing a lot of outreach to survivors, one-on-one phone calls. And so our model is that our advocates have always had a one-on-one relationship with survivors in the community we work with. So it's been a lot of phone calls, checking in, following up. And that's how we knew that more men were answering the phone. And that's where we have the suspicion that more orders of protections were being violated through this time, because we were doing that one-on-one outreach. And it's calling all of our clients also just to check in on them, and to let them know that Sakhi's still here, two, to let them know that, you know, we're now delivering groceries and core essentials, and three, to reaffirm that if they do get sick or anything, that we still are there to support them through the process.
Great. This is a great answer. Thank you. And then my other question was, that, especially in Trump America, but in general, that many of these women are also at risk because of their status as an immigrant. And whether they are undocumented or their immigration status is just unclear or unsure. And I certainly know that within family-based violence, even immigration status can be used as a tool of violence. So I'm just curious if your services also address that very issue and just what you see as the intersection between the injustice around immigration policies and family violence.
Yeah, so on a direct service level, like we have about 10% of the clients that we work with are undocumented. And so we've been, trying to navigate through those particular cases in a much more nuanced way, which has been such a challenge in this environment. And, for the most part, thankfully, a lot of the survivors we work with have been protected under VAWA, which has been great. But as I mentioned, the new executive order has created a new level of fear for the community that we work with. I think from a systems change level, I think what we're trying to do more and more is continue to talk about the layers of fear that our community continues to work with and live in and tries to navigate through. I mean, it is not uncommon for the survivors that we work with to have never taken the subway, to have to Uber to our office, to not speak English, or to have been confined to their home and never have been anywhere else. And so when we think about all of those things, and trying to lift up that narrative, it's really, it's important for us to be able to demonstrate to the broader community what levels of complications, fear, and intersections that people live with in New York City and the survivors that we work with.
Violence Against Women Act is what.
Yeah.
Yeah.
Thank you.
I just want to highlight that because I also think it's so important when we think about advocacy, and the foundation does a lot of advocacy work, that there's very real intersection, right? You're talking about very specific on the ground gender-based violence, and yet Violence Against Women Act is a federal policy that we have to continue to fight for because it always comes up for vote. Yeah. So I also think it kind of highlights the importance of the intersection. And Amy, I know you agree, and you can speak to this too, that it's always important to think about both how we can help from an advocacy standpoint as well as a direct service standpoint.
Mm-hmm.
Amy,
so we have one last question, and then we'll close it off. It's sort of a sense of, how has, not having the gala really impacted your budget? And also, how has the crisis impacted your organizational budget?
Oh gosh, those are big questions. So we decided to not have a gala in mid-March, and what we had to do was go back to all of our donors who had committed to the event. What we heard from our donor community was, it's not about a celebration, it's not about a party, it is about their respective commitment to our movement. And we were able to then come up with and really provide an opportunity to our funding community, or to our donors in particular, a campaign called Isolated But Not Alone. And I would say that we have reached more than 60% of our goal, and we're really happy with how it's trending right now. It demonstrates to us that our funders, our donors, believe in our work with or without an event. And I think it again gave us that confidence, because I mean, to not to sort of harp on the food security thing, but to go out and actually buy groceries and hand deliver them to survivors, ensuring the safety, ensuring that we are still there and supporting them through this moment. We could do that because of our funding community, because it empowered us to do so. And so while we have unforeseen expenses, right now we feel okay. And fortunately, our board has been very supportive with the decision-making process as well.
So we have a few more questions, but I'm also very mindful of time. And so for folks on the webinar, we will get back to you with some of our responses and also share the article that Kavita mentioned in the New York Times. And so thank you all so much for all of your thoughtful questions, and thank you so much for your interest and support in our work, in the work of organizations like Sakhi. I also wanted to thank you, Kavita, so much for joining us today to share what you're seeing on the ground and how you are all supporting survivors, and just very grateful for your partnership. And for folks on the webinar, if you have questions about the fund, please send us an email at covid19@brooklyncommunityfoundation.org, and we look forward to hearing from you. And with that, I will pass it to Cecilia, who will close out our webinar today.
Thank you, Amy, and thank you so much, Kavita.
Thank you.
You're very brave to say that you're okay right now. That's because you're obviously an excellent executive director and you're running an organization very beautifully. But I can't stress enough really how nonprofits across the board are truly doing a Herculean effort here, trying to maintain their organizations. We've just been so moved at not only their ability to pivot to emergency services, but also keep their organization going and keep their staffs employed. And I think that Kavita gave a great example of that. So again, thank you so much for joining. If you'd like to learn more about the fund, please go to our website. It's the Brooklyn COVID Response Fund. Again, we're so honored to be able to say that we've gotten out over $1 million in grants to community-based organizations, and we are continuing to do this work. One thing I want to say about this crisis in general, and I know the time has a funny way of being very warped right now, but this is clearly a very long-term situation. And I think, as Kavita illustrated so well, even within the past few weeks, her issues have shifted. And we're going to see that with this crisis. And Brooklyn Community Foundation has every plan right now to stick by all these organizations and other organizations in Brooklyn who are going to be here for the long term, coping with this crisis. And we want to do every effort we can to sustain the excellent work that's happening on the ground in Brooklyn. So again, I encourage you to please tell people about our fund, to support us. And thank you so much for joining. And I hope that you're all safe and healthy and as happy as can be, and enjoy the weekend. Thank you so much.